LED light mask. I'm Ellie Dove, and this is What the Wellness. So over the years that I've been hosting What the Wellness, LED light therapy has been offered to me more times than I can count. It's offered in the dermatologist's office, it's offered in Stretched, it's offered at the, old school esthetician who's there to try to get all the blackheads out of your face. And so what that tells me is that there's something to this very bright science. I am trying out Dr. Dennis Gross's LED light mask. So this is a mask you wear that's loaded with a constellation of LED lights.
Hi everyone, I'm Dr. Melissa Canchenomie-Levine. I'm a board certified dermatologist and owner of Ontier Dermatology.
Can you explain what LED light is and what it's supposed to do for the skin?
So LED, it stands for light emitting diode. And basically what it is that it's emitting light in a specific spectrum. So it can be ultraviolet, it could be visible, it could be near infrared. And basically we use these different light energies to treat different conditions. And it works by modulating or changing cellular activity. So it might seem like a trend because you're seeing it more, but it's actually a very old treatment that we know a lot about. But the question is how effective is the LED light that you're getting in a nail salon or a Medi-Spa, dermatology office, and at home? And that's where I think there's a lot of confusion.
Hi, I'm Dr. Dennis Gross. I'm a New York City dermatologist, born and bred in New York, and my background started as a skin cancer researcher, and then I morphed into the world of clinical dermatology, and then I actually took my research background and my clinical dermatology degree and started to create products.
So before we get into what this glorious piece of equipment does, can you tell me what LED light does with the skin?
There's different lights that exist in nature. We know there's visible light. We know there's ultraviolet light, which is sunshine. We know there's infrared, but then there's also something called LED, and that's what this is. This is a certain wavelength of light that has activity on the skin, and there's no downtime, there's no dangers, there's no radiation, but its powers are tremendous. It was actually first developed by the space program, by NASA, to improve wound healing in space. But then the world of dermatology found more uses for it. It stimulates one's own collagen. It works on reducing redness. It works on complexion concerns by killing the bacteria that causes acne. And it helps regulate oil control. And so it does many things, both in terms of the anti-aging and firming of the skin, redness, inflammation, and acne, or anything like rosacea. It's my idea to create a device that allows people to do it at home. This is a biologically active medical device. The key thing is we were able to get the power out of this device that really made a difference.
And it's so easy, it honestly feels too good to be true. Because you put it on, you don't really feel anything. Sure, it's bright, but it's not hot. Does it really work?
So it's really easy to use. 3 minutes a day. You see results starting in about 2 weeks, and they get better and better. The procedure done in the office with the machine that's available professionally is stronger. But by using this every single day, it does add up, because when you're stimulating collagen, it gets accustomed to it.
Is an LED light treatment outside of the dermatologist's office even effective?
It can be. It's hard to say with certainty because there's no head-to-head studies to compare. So in general, in a medical practice, like a dermatologist practice, we invest in medical grade technology that has been studied for conditions, right? For pre-cancers, for acne, but there's a lot of commercial products that haven't been vetted and haven't been clinically studied.
And so do you recommend people try using different LED light therapies at home?
Honestly, I love LED. I think it's a great treatment. We know that there's actually a lot of great data on it. And if you've had a treatment in a dermatologist's office and you respond well to it, then it's totally beneficial to do it at home, especially nowadays when it's hard to come into the office.
So Dr. Dennis Gross's mask is a serious investment. It is $435. That is more than I spend on most things. If you're somebody who is regularly getting LED light treatments in the doctor's office, you could probably earn back the money on your face mask investment pretty quickly. If you're not somebody who's getting LED light treatments all the time, it is a serious investment. So the thing about LED light, it's not like, you don't get one LED light facial and walk out like, wow, I look 10 years younger, or wow, all my acne is gone. It is a consistent practice. So the mask is great because it allows you to use the treatment really consistently. It's 3 minutes a day. Dr. Dennis Gross told me that his wife uses it in the morning when she makes coffee, so I started using it in the morning when I make coffee. So far, I've been using it for about 3 weeks, and I have to say that I am seeing less acne, and like I am in the sun all the time, and I don't see any new wrinkles, but I don't think you see wrinkles that quickly. It's a hard thing to justify unless you have the kind of disposable income required to buy a $435 mask. What I will say about it is, unlike other tools and skincare gadgets, you don't need an app. It's really easy to use. You charge it once and you can use it like 10 times. So it does feel like something that you can really easily integrate into your routine. So once you make the investment, you're set up for success, which I really like about it. I'm Ella Dove, and this is What the Wellness. Want more What the Wellness? Subscribe to Ellen's YouTube channel right now.